Hello everyone, welcome to Pediatrics by Dr. Anand, and this is the Nursing Next Live platform. And first of all, I would like to congratulate everyone who has given the recent Norcet exam, and congratulations that whatever we had studied in the field of pediatrics, almost every question here and there has come from that. So that's a very, very, very good news. So congratulations to everyone whosoever has participated. And most importantly, let's start. So in the Aiims Norcet, like the which analysis which we did for the Aiims Norcet 2021, most of the questions came from OBG, from our pediatrics, and also from the forensic medicine. Okay, most of the questions. Approximately 20 questions were clinical based. As I tell you in all my classes, clinical based questions they're asking a lot nowadays. So most of the questions they were little, clinical based questions. And most importantly, image based questions around 4 to 5. Around 4 to 5 जो है, they were image based questions. And of course, like as COVID is the latest thing happening, so approximately 2 to 3 questions were based on the COVID. And then integrated questions were there on the community medicine, pathophysiology, microbiology, and pharmacology. There were no video based questions in this our Norcet exam. Shift 1 and shift 2, it was divided into shift 1 and shift 2. It happened on 20th November 2021, and we are here now to what do you call it, discuss the recall questions, basically what we feel might have come, the recall questions, basically roughly what we feel has come in the exam. We are here to discuss that. Okay. And again, what students say about the Nursing Next Live app after giving the Norcet exam, like this recent Norcet exam जो हुआ है, तो I mean we have got a wonderful feedback from the students. Beautiful feedback we have got from the students. We have the student Piyush Kumar Patil. He says, "Hello sir, I'm Piyush Kumar Patil, paid user of Nursing Next Live app. First of all, I would like to tell you thanks to all the mastermind faculties and an entire team of Nursing Next Live to work as a mentor for the future nursing officer. The team will provide a content which was excellent and above the expectations for Norcet 2021 and even any of the nursing exam. Result is another matter, but the preparation for Norcet 2021, which is provided by the Nursing Next Live, was superb, and thanks to all mastermind faculties." This Piyush Kumar Patil had told. We have this now Sunil Alvaria. Sunil Alvaria says, "Good evening, ma'am. A big thanks to all my Nursing Next Live faculties who conducted daily Chalo study classes on Zoom." Do you remember, friends? We were there on the Chalo study classes on Zoom. We all faculty used to come at least for some time and used to little motivate you. So that's what a student says here. "I want to give a special thanks to Dr. Sakshi Arora Hans ma'am to make our obs and gynae so easy, and heartily thanks to Dr. Anand Bhatia sir who always motivate us in the critical period of preparation." So these are the wonderful feedback which we have got, and life has been so beautiful. I mean, together we all had started studying. It was like I am also studying, you're also studying, everyone is studying. It is like that, and it's amazing. यहाँ पे एक स्टूडेंट हमारा लिखता है कि मैम पेपर तो ऐसा लगा कि पूरा का पूरा नर्सिंग नेक्स्ट ने ही बनाया था, एज इट इज़ चीज़ें देखने को मिली हैं। सो बहुत अच्छी बात है, ये तो बहुत ही सुंदर बात है। आई मीन इट्स ब्यूटीफुल एंड सो मेनी सोनिया, शाहिद, सपना, विकास, so many people we have got this beautiful feedback from the every student who has attended this Nursing Next Live app, watched the videos, who has seen the chanting videos, revision classes। मतलब क्या नहीं है, मतलब सब कुछ हमने इसमें डाला हुआ है। पीडियाट्रिक्स की अगर मैं बात करूँ तो हमने चैंटिंग सेशंस, हमने रैपिड रिविजन्स, हमने 10-15 पता नहीं कितने साल के एम्स के पेपर्स का डिस्कशन डाला हुआ है। सो इट्स अमेजिंग, आई फील। आई मीन बहुत अच्छी बात है ये। यहाँ भी हम हमारी सोनिया मैम लिखती हैं कि all of you are very helpful for us, and one point is explained very very well by the teachers. All teachers are, yes, so all teachers are good, knowledgeable, and yeah, so all these beautiful comments we have got. Exam was moderate according to me, but I felt it moderate because of the Nursing Next Live, otherwise it would be hard. This is also nice, very nice वेरी गुड। यहाँ पे भी हमारे जो है विकास गौर लिखते हैं, यहाँ इन्होंने लिखा है कि दिल से बोल रहा हूँ, आप वाली कोचिंग से मोहब्बत हो गई है। सो अगेन दैट्स वेरी ब्यूटीफुल, दैट्स वेरी नाइस, यू नो। बहुत अच्छे से लिखा है सबने, और बहुत लॉट ऑफ, आई विल नॉट रीड एवरीवन्स कमेंट, बट वी हैव दिस कंचन पॉल, शी हैज़ मैसेज, वी हैव पुनीता, she has beautifully, spoken about it. We have Sahil Srivastav who has spoken. It was a good experience being a member of Student Ambassador program of Nursing Next Live. Today I have found that many questions came from Nursing Next Live app. Thank you. यहाँ लिखते हैं हमारे पुनीता दैट हाँ सर, ऑसम गया पेपर, सेकंड शिफ्ट था, एंड कम्युनिटी एंड फोरेंसिक की फैकल्टी को स्पेशल थैंक्स, 135 टू 140 मार्क्स तो पक्का आ जाएंगे। बस बहुत बढ़िया, फिर तो और क्या चाहिए भाई। आई मीन एवरीवन हैज़ गॉट इट, इट्स अमेजिंग, right? So now let's start the Aims Norcet 2021 recall questions pediatric nursing by Dr. Anand. My name is Dr. Anand. I'm MD pediatrics and I'll be discussing the recall questions for the recent Norcet exam जो इस साल हुआ था. Please remember these are the memory based questions which we have tried to get from the students and everyone. Okay, these are not the exact questions, of course. These are just the recall questions. And student who are newcomers, जिस आज इस क्लास में जो नए लोग हैं, जो नए हमारे बैचेस हैं, नए स्टूडेंट्स जो हमारी ऐप से देख रहे हैं, सुन रहे हैं, हमारे यूट्यूब चैनल्स को देख रहे हैं, तो ये जो वीडियो है आप सबके लिए एक स्टार्टिंग के लिए बहुत इंपॉर्टेंट है, क्योंकि आई ऑलवेज से दैट रीसेंट क्वेश्चंस आर वेरी इंपॉर्टेंट, हाई यील्ड टॉपिक्स आर वेरी इंपॉर्टेंट, लास्ट 3 ईयर क्वेश्चन पेपर्स आर वेरी वेरी इंपॉर्टेंट। तो ये सब चीज़ें जो हैं, मतलब दिस इज़ द फ्रूट, मतलब यही चीज़ें ही काम आएंगी, तो ये लास्ट 3 ईयर क्वेश्चन पेपर्स में से हमेशा रिपीटेड क्वेश्चंस आते हैं, हमेशा कुछ ना कुछ दोबारा पूछा जाता है, तो ये वीडियो हमारे लिए बहुत इंपॉर्टेंट है। सो लेट्स स्टार्ट द मोस्ट ब्यूटीफुल सेशन। एंड हमेशा सेशन शुरू करने से पहले आई ऑलवेज हैव अ मोटिवेटिंग कोट, एंड टुडेज कोट सेज, अ फ्लावर डजंट थिंक ऑफ competing to the flower next to it. A flower doesn't think of competing to the flower next to it. It just blooms. It just blooms. तो इसका मतलब क्या है कि एक फूल जो है वो कभी भी compete नहीं करता दूसरे फूल से कि भाई मैं उससे ज़्यादा सुंदर खिलूँगा। वो फूल अपने से खिलता है, दूसरा फूल अपने से खिलता है। सो यहाँ मोरल ऑफ स्टोरी ये है कि आप अपनी प्रिपरेशन अपने हिसाब से करिए। ऐसा नहीं कि वो कम पढ़ रहा है तो मैं ज़्यादा पढ़ूँगा, या कोई जेलसी की भावना को लेके या गुस्से की भावना को लेके, यू शुड नॉट हैव एनी काइंड ऑफ जेलसी और एनी काइंड ऑफ inferiority or superiority complex amongst your friends or anyone who is studying mates. You study in your own speed, let the other person study in their own speed. Please do not demotivate anyone, do not discourage anyone, and do not make fun of anyone. हर किसी का अपना तरीका होता है, आपका अपना है, दूसरे का अपना है। You will shine in on your own day, the other person will shine on its own day. Just because not telling him the answer, not revising with him, I have seen people not sharing the answers कि नहीं नहीं मैं अपना बता दूंगा तो उसका ज़्यादा नॉलेज हो जाएगा, मेरा भी आंसर्स वो पता कर लेगा। नो, you should share knowledge ना, whenever you are studying and revising. Make, the more you make other person remember or teach, you remember better. It's like this. भगवान कहते हैं कि जितना तुम दोगे उससे डबल पाओगे। तो जितना नॉलेज तुम दोगे, द मोर यू गिव योर नॉलेज टू समवन, यू विल गेट डबल, यू विल गेट ट्रिपल गेन आउट ऑफ इट। तो यू शुड नॉट हैव एनी नेगेटिव थिंग इन योर माइंड। द डे यू विल शाइन, द डे अदर पर्सन हैज़ टू शाइन, ही विल शाइन। सो डोंट पुल और पुश, just live and enjoy life. So starting with the first question is, which of the following is not a sign of good attachment? Which of the following is not a sign of good attachment? So of course, like, first let me tell you, this is a breastfeeding topic, yes or no? This is like very beautifully the question has been portrayed and it has come from our teaching only. जो हमने अगर आपने मेरी recent videos देखे हो तो हमारा जो breastfeeding का chapter था, breastfeeding का जो वीडियो बनाया था, उसमें सबसे पहली लाइन उसमें यही मैंने आपको पढ़ाई है कि व्हाट आर द साइंस ऑफ गुड अटैचमेंट। एक बच्चा जब माँ से अटैच होता है, व्हेन द बेबी सक द मदर्स ब्रेस्ट, सो वी सी द साइंस ऑफ गुड अटैचमेंट in the topic of breastfeeding, yes or no? So the signs in general, like the options are, which of the following is not a sign of good attachment? Options are, upper side areola more exposed than the lower, widely open mouth, chin touching the breast, and lower lip is inward. So most importantly, do you remember, आपको याद है what were the signs of good attachment? Who will tell me? So the sign of good attachment are: number one, chin touching the breast. Most important, ये this is exactly from the what you called the thing which we the chapter which we covered together, breastfeeding, जो हमने पढ़ा था हमारे अलग वीडियो ऐप के अंदर, exactly उसी का ये मैं स्लाइड आपको शेयर कर रहा हूँ कि हमने पढ़ा था ये, और exactly ऑलमोस्ट उससे मिलता जुलता क्वेश्चन आया है। नंबर वन, व्हाट आर द साइंस ऑफ गुड अटैचमेंट? एक बच्चा माँ से जब अटैच होता है तो कैसे पता कि ये अच्छे से ब्रेस्ट फीड ले रहा है? नंबर वन, चिन टचिंग द ब्रेस्ट, द बेबीज चिन शुड टच द ब्रेस्ट। लेट मी शो यू अ पिक्चर, वन सेकेंड। या दिस इज अ वेरी ब्यूटिफुल पिक्चर, कैन वी सी chin touching the breast? Number one, chin touching the breast. Number two, mouth wide open with fullness of cheeks, mouth wide open with fullness of cheeks, है ना? We have to understand, okay, like don't cram, रटना नहीं है, हमने समझ के पढ़ना है, समझ के। एंड आई ऑलवेज टेल यू, फोटोग्राफिक मेमोरी इज एवरीथिंग। फोटो देखिए और आंसर करिए, इट इज एज सिंपल एज दैट। तो ये हम क्या पढ़ रहे हैं यहाँ पे? हम पढ़ रहे हैं व्हाट आर द साइंस of good attachment in a case of breastfeeding. The signs are: number one, chin touching the breast, number one. माउथ वाइड ओपन विद फुलनेस ऑफ चीक्स, मुंह फूला होना चाहिए बच्चे का। नंबर थ्री, वेरी इंपॉर्टेंट, लोअर लिप। नंबर थ्री इज, ये क्या है यहाँ पे? बेबी का लोअर लिप should be everted out. Baby's lower lip should be everted out, बाहर होना चाहिए। Baby's lower lip should be everted out. बच्चे का जो ये lower lip है यहाँ पे, ये ऐसे बाहर की तरफ होना चाहिए। Lower lip should be everted out. And last but not the least, mother's upper areola. Mother's upper areola should be exposed out. मदर्स अपर एरियोला शुड बी एक्सपोज्ड आउट। मतलब मदर का, हम आप जानते हो ना, यहाँ ये निप्पल है तो ये पूरा हमारा ही एरियोला है, तो जो अपर है एरियोला है ये वाला पार्ट, मदर्स अपर एरियोला शुड बी एक्सपोज्ड आउट, ओके। एंड बेबी का लोअर लिप शुड बी ईवर्टेड आउट, बाहर की तरफ होना चाहिए, अंदर की तरफ नहीं। इट शुड नॉट बी इनवर्टेड, इट शुड बी ईवर्टेड, बाहर बाहर की तरफ होना चाहिए। तो दीज आर द साइंस, ब्यूटिफुल साइंस ऑफ गुड अटैचमेंट इन अ केस ऑफ ब्रेस्ट फीडिंग। अब चलते हैं हमारे क्वेश्चन की तरफ। तो हमारे क्वेश्चन में, इसमें क्वेश्चन था विच ऑफ द फॉलोइंग इज नॉट अ साइन ऑफ गुड अटैचमेंट। तो इन्होंने लिखा लोअर लिप मूव इनवर्ड। सो this word lower lip inward, this is wrong. Lower lip is everted out. बच्चे का lower lip जो है बाहर की तरफ होता है, everted, ऐसा करके होता है when he is sucking the breast. बस हो गया, क्वेश्चन खत्म। समझ में आया आपको? आर यू विद मी? आर यू विद मी? क्या आप समझ पा रहे हैं जो मैं आपको पढ़ा रहा हूँ? तो ये बहुत इंपॉर्टेंट पॉइंट है। हमने ब्रेस्ट फीडिंग अच्छे से, बहुत अच्छे से कवर किया है। अच्छा, मैं अगर आपसे एक एक्स्ट्रा सवाल पूछूं, व्हेन डू यू सेलिब्रेट ब्रेस्ट फीडिंग वीक? एनीवन? व्हेन डू यू celebrate breastfeeding week? So the answer is first week of August. The answer is first week of August. जो भी क्वेश्चंस आएंगे आई कीप आस्किंग यू, एसोसिएटेड क्वेश्चन जो भी मुझे मेरे मन करेगा मैं आपसे पूछ लूँगा, ताकि हमारी अच्छे से रिवीजन हो जाए। एंड प्लीज़, जो भी आप ये क्लास पढ़ रहे हैं मेरी, आई ऑलवेज टेल एवरीवन, आप एक कॉपी लीजिए, एक पेन लीजिए और उस पर लिखिए कॉपी पे पहले पीडियाट्रिक्स बाय डॉक्टर आनंद, और नोट्स बनाने शुरू कर दीजिए जो मैं पढ़ा रहा हूँ आपको। आप देखिएगा, आप रोज़ मेरे वीडियोस देख सुनेंगे, नोट्स बनाएंगे तो और ज़्यादा जल्दी आपका सिलेबस फिनिश होगा एंड यू विल रॉक। जैसे हमारे पुराने बैच ने सुपर रॉक किया है, ऐसे ही आप भी रॉक करेंगे, ठीक है? चलो, ब्रेस्ट फीडिंग वीक व्हेन डू यू सेलिब्रेट? द आंसर इज फर्स्ट वीक ऑफ ऑगस्ट, फर्स्ट वीक ऑफ ऑगस्ट, ठीक है? व्हेन डू यू सेलिब्रेट डॉक्टर्स डे? एनीवन? When do you celebrate Doctor's Day? The answer is 1st July. 1st July. When do you celebrate World Malaria Day? Anyone? World Malaria Day कब आता है? World Malaria Day आता है 25th of April. 25th of April. समझ में आ रहा है? मैं आपको back to back I'm asking you questions so that you finish it off. Okay. Breastfeeding week, first week of August. Doctor's Day, 1st July. World Malaria Day, 25th of April. World Malaria Day, 25th of April. World Environment Day, वातावरण दिन कब आता है? World Environment Day. World Environment Day comes at 5th June. 5th June. World Environment Day comes at 5th June. Okay, I think that's enough. And if okay, one more if you want to remember, World Rabies Day. World Rabies Day, 28th of September. 28th of September we celebrate World Rabies Day. So in this one question I have told you like 7 questions. These all are exam questions. World Rabies Day, Doctors Day, Environment Day, Malaria Day, Breastfeeding Week, these all are exam questions. So very good, हम सारा सिलेबस खत्म कर देंगे, बहुत बढ़िया, ठीक है, वेरी गुड. नाउ क्वेश्चन नंबर 2, व्हाट इज द रेंज ऑफ मिड अपर आर्म सर्कमफ्रेंस फॉर माल न्यूट्रिशन. वेरी सिंपल एंड वेरी ब्यूटीफुल क्वेश्चन एक्चुअली, कि भाई माल न्यूट्रिशन में मिड अपर आर्म सर्कमफ्रेंस का MUAC का मतलब क्या होता है, मिड अपर आर्म सर्कमफ्रेंस. मिड अपर आर्म सर्कमफ्रेंस, जो बच्चे का ये मिड अपर आर्म ये जो होता है इसका सर्कमफ्रेंस. तो ये भी हमारा एग्जैक्टली सैम टॉपिक. आपको याद है हमने सैम टॉपिक पढ़ा था. सैम हमारा एक ब्यूटीफुल सा चैप्टर है. सैम क्या होता है, एनीवन? सैम इज सीवियर एक्यूट माल न्यूट्रिशन, है ना. सैम सुना होगा आपने. पहले हम इसको क्या बोलते थे, पहले हम इसको PM कहते थे. PM क्या होता है सर? PM होता है प्रोटीन एनर्जी माल न्यूट्रिशन. प्रोटीन एनर्जी माल न्यूट्रिशन. लेकिन अब हम बोलते हैं इसको सैम. अब सैम बोलते हैं. सैम क्या होता है? सीवियर एक्यूट माल न्यूट्रिशन. सीवियर एक्यूट माल न्यूट्रिशन में हमारा एक मिड अपर आर्म सर्कमफ्रेंस हम लेते हैं बच्चे का, तो उसमें क्या आंसर बेस्ट होगा? ऑप्शन आर 12.5, 11.5, 13.5, 14.5. द आंसर इज लेस देन 11.5. मिड अपर आर्म सर्कमफ्रेंस लेस देन 11.5 सेंटीमीटर जब होता है तो उसको हम बोलते हैं, लाइक अगर एक बच्चे का मिड अपर आर्म, ये अपर आर्म है, इसका मिड मतलब ओलिक्रैनियन प्रोसेस और एक्रोमियन प्रोसेस का मिड जो होता है, मिड अपर आर्म सर्कमफ्रेंस, पूरा सर्कमफ्रेंस जो हम इंची टेप से, शाकिल टेप से हम जो इसको मेजर करते हैं, इफ दैट इज लेस देन 11.5 सेंटीमीटर, देन आई विल से बच्चा क्या है, बच्चा सैम वाला बच्चा है, सीवियर एक्यूट मालन्यूट्रिशन. अगर मैं आपको हमारी वो स्लाइड्स दिखाऊं जो हमने पढ़ी थी, दिखाता हूँ आपको. ये देखो WHO, ये हमारी कहाँ, ये हमने सैम के टॉपिक की स्लाइड्स मैंने उठाई हैं यहाँ पे. आई वांट टू शो यू कि ये हमने पढ़ा हुआ है. इट्स एग्जैक्टली वी हैव कवर्ड फ्रॉम दैट टॉपिक. सो रिमेंबर सैम इज डिफाइंड एज नंबर 1, वेट फॉर हाइट लेस देन -3 स्टैंडर्ड डेविएशन, है ना. दिस इज वेरी इंपॉर्टेंट. आई टोल्ड यू इन द क्लासेस ऑल्सो, बहुत इंपॉर्टेंट है ये, बेसिक पक्का पूछते हैं. हाउ डू यू डिफाइन सैम? WHO जो है, वर्ल्ड हेल्थ ऑर्गेनाइजेशन, हाउ डज इट डिफाइन सैम? सैम का डेफिनेशन क्या होता है? द आंसर इज सैम इज डिफाइंड एज 3 पैरामीटर्स. नंबर 1, वेट फॉर हाइट लेस देन -3 स्टैंडर्ड डेविएशन, mid upper arm circumference less than 11.5 centimeter, and bilateral pitting type of pedal edema. Okay, yeah, so this is the 3 important criteria. और ये यहाँ ये वाला जो है एग्जाम में ऑलरेडी आ चुका है, मिड अपर आर्म सर्कमफ्रेंस लेस देन 11.5. सो फिनिश हो गया. सेकंड क्वेश्चन ऑल्सो फिनिश्ड, है ना. डन, वेरी गुड. ओके, third question. Premature babies have more chances of hypothermia because of all of the following except. हाँ, ये बहुत अच्छा पॉइंट है, बहुत अच्छा पॉइंट है ये, ठीक है. प्रीमेच्योर बेबी, यू नो, नाउ दिस इज वेरी इंपॉर्टेंट पॉइंट. प्रीमेच्योर बेबी, बेसिकली प्रीमेच्योर बेबीज जो हैं उनमें हाइपोथर्मिया के चांस ज़्यादा होते हैं, है ना. प्रीमेच्योर बेबीज हैज़ अ वेरी हाई चांस ऑफ हाइपोथर्मिया. प्रीमेच्योर बेबीज जो हैं वो ठंडे जल्दी पड़ जाते हैं. प्रीमेच्योर बेबीज हैव मोर चांस ऑफ हाइपोथर्मिया. क्यों? क्योंकि प्रीमेच्योर बेबीज में क्या होता है, जो उनका जो उसमें ब्राउन फैट उनमें कम होता है. पहली बात, ब्राउन फैट क्या होता है? बेसिकली ब्राउन फैट जो है हमारे NST में हेल्प करता है. NST क्या होता है? नॉन शिवरिंग थर्मोजेनेसिस. ये भी हमने क्लासेस में पढ़ा था, मैं आपको दोबारा बताता हूँ. इफ़ यू आर अ न्यू कमर, आई विल टेल यू अगेन. Premature, more the baby is premature, more the baby can go thanda, can go cold, can go hypothermia. Why? Because for a normal baby to maintain its heat, or I would say thermogenesis, it needs brown fat. Normal baby needs brown fat for the formation of heat. How does it form? Like there is a breakdown of brown fat. Then what will happen? Heat is formed, thermogenesis takes place. Okay, and most important, this thermogenesis is non-shivering thermogenesis. Non-shivering means normally you and me, we shiver, okay, like that. Okay, so you and me shiver. In general, we shiver. That is normal. Why are we shivering? To increase the heat production for the thermogenesis. You and me, adult, we shiver once we shiver, what will happen? Our body temperature raises like by shivering. So we can shiver, but newborn baby do not shiver. They have a non-shivering thermogenesis. They have a different mechanism of production of heat. How? By the breakdown of brown fat. So that is what premature babies are more prone for hypothermia, because because of the breakdown of the brown fat, because of the breakdown of the brown fat. This much you understand, right? And that is what they say, they have a non-shivering, they have a non-shivering thermogenesis. Okay, very good. So yes, so coming further, very important that let's do the options. Premature babies have more chances of hypothermia because of all of the following except. So number one, see, if like let's go one by one. If the babies have a less brown fat, that's they if a newborn baby will have a less brown fat, then of course they will, they will lead to hypothermia. Yes or no? Just now I told you brown fat is important, right, for the baby, for the heat production. So premature babies have more chances of hypothermia. Yes, if there is less brown fat, yes, there are more chances of hypothermia. When there is cold environment, naturally baby will go into hypothermia. And normally premature babies have a less developed epidermis. They have less developed epidermis. So A, B, and C options can lead to hypothermia. A, B, and C options can lead to hypothermia. So the question is, premature babies have more chances of hypothermia because of all of the following except. So which option does not lead to hypothermia? Okay, so the answer for this is option number D. Wait 1 second, I'll just erase this part. Yeah, this one. So option number 3, D. What does option number D says? Small body surface area in comparison of weight. That is not a right statement. In general, newborns have a bigger body surface area, not a smaller body surface area. Newborn baby in general, the body surface area, remember, the head has a very bigger circumference. The head has a very big circumference, and from the head basically there is more and more heat loss is there from the baby, and that can lead to hypothermia. So saying small body surface area in comparison of weight, that is not the right option. That is not the right option. Did you understand? So when there is less brown fat, yes, baby can be hypothermic, because less brown fat means less brown fat breakdown and less thermogenesis, so baby can go to hypothermia. When there is cold environment, yes, baby can go to hypothermia. Baby has a naturally less developed epidermis, so that also baby can land up into hypothermia. And small body surface area in comparison of weight, no, that is not the right answer. That is, they have a big body surface area, and that again, big body surface area can lead to heat loss. But saying small body surface area, this is not the right option. This is not the right option. That's why option number D is a best answer. Option number D is a best answer. Okay, done. ओके, एंड ऑल्सो आई टोल्ड यू व्हाई न्यूबॉर्न्स आर मोर प्रोन फॉर हाइपोथर्मिया. छोटे बच्चों में बहुत ठंडे क्यों हो जाते हैं छोटे बच्चे? बिकॉज नंबर वन, आई टोल्ड यू, प्रीटर्म बेबीज एंड स्मॉल फॉर जेस्टेशनल एज हैव अ लेस ब्राउन फैट. सो लेस ब्राउन फैट मीन्स लेस ब्राउन फैट breakdown, means less thermogenesis, less heat production. Baby will be hypothermic. And very important, large surface area of head. See, large, they have a large surface area of head, not small surface area. They have a large surface area. Okay, and then shivering is absent. I told you this point also. Shivering is absent. Shivering is absent because newborn babies cannot shiver, so they have non-shivering thermogenesis by the breakdown of brown fat. Okay, so that's why. So the best answer for this question will not be less brown fat, will be small. This option number D is our best option. Many babies, I'm saying, many students have written option number C as the best answer. So option number C is not the right answer. I would say option number D is the right answer. Option number D. Okay, option number D. Very good. Let's move further. Which of the following is the most commonest cause of UTI in children? Again, a very simple question. We have already covered in our kidney and GI tract. We have covered this question. So which is the most common cause of urinary tract infection in children? Options are E. coli, Proteus, Staph aureus, and Pneumococcus. The answer is E. coli. E. coli is the most commonest cause of urinary tract infection in the children. So let's revise a little bit about the urinary tract infection. You all know that during infancy is till what age? Infant is basically till 1 year. Yes or no? Infant is till 1 year. So during infancy, incidence of urinary tract infection is more in boys than the girls. Is more in boys than the girls. But once beyond infancy, OPGI 9th edition says that beyond infancy, girls have a higher incidence of UTI than boys. But during infancy, boys have a higher incidence of UTI. Point number one. Okay. Point number two, in urinary tract infection, what are the clinical features? What do you think? A UTI urinary, the name itself says, no, urinary tract infection. So what the baby will come with? In general, children will come as a complaint of cry while passing urine. Cry while passing urine, or you can say pain while passing urine. Kind of, when the baby strains to pass the urine, all these conditions can lead to is a feature of urinary tract infection. मदर गिव्स अ हिस्ट्री कि ये जब सूसू करने जाता है बच्चा तो सूसू पकड़ लेता है, या सूसू रोक रोक के करता है, या रोता है बहुत ज़्यादा जब सूसू करता है। बोलते हैं मम्मा मेरे को दर्द हो रहा है, आई एम फीलिंग पेन मम्मा, I am having some uncomfortability, I am feeling burning sensation. Are you understanding? So children will come and tell you pain while passing urine, cry while passing urine, they have to strain while passing urine, and also there is something known as urgency, hesitancy, and frequency. Have you heard the names? Urgency, hesitancy, and frequency. Urgency matlab, if I want to go to washroom right now, I'll run away to go to washroom. I can't even wait for 2 minutes. I can't even control my bladder. I have to just go right now. मुझे अभी जाना है सुसु करने. So that's known as urgency. Hesitancy, mother gives a history कि सुसु बोलता है सुसु आया है, बाथरूम जाता है तो खड़ा रहता है वहाँ पे, धीरे धीरे थोड़ा थोड़ा झिझक झिझक के सुसु करता है, तो हेजिटेंसी. एंड फ्रीक्वेंसी, मदर गिव्स अ हिस्ट्री कि शी गोज अ लॉट ऑफ टाइम टू टॉयलेट डॉक्टर, लाइक every half an hour she is going to toilet, every half an hour, every 1 hour she is going to toilet. So increased frequency of the passing urine also another symptom of urinary tract infection. Okay, so point number one, pain and cry while passing urine. Point number two, straining during passing urine or kind of dribbling of urine, very important. And also urinary urgency, hesitancy, and frequency, which I told you just now. And also, what is the treatment? So anyone, what's the treatment of which drug do you want to give for what you called urinary tract infection? So it all depends, is are we talking about simple urinary tract infection or a complicated urinary tract infection? Two things we have to see, what are we talking about? Is it a simple UTI or a complicated UTI? If it is a simple UTI, oral treatment, if I talk about, one of the important drugs is cefixime. Which we give. Okay, if we talk about complicated UTI, then of course intravenous drug you have to give, and you have to give ceftriaxone, which is cephalosporin third generation. Okay, ceftriaxone drug. Ceftriaxone is given at the rate of 75 to 100 milligram per kg per day. Okay, ceftriaxone is given 75 to 100 milligram per kg per day, whereas cefixime you give at the rate of 10 milligram per kg per day. 10 milligram per kg per day. So I'll repeat again, what's the treatment of UTI? Like in general, once you get a urine culture ka report, what exactly do you do? We have to see it is a simple UTI or a complicated UTI. If it is a simple UTI, you give oral drugs. If it is a complicated UTI, you give IV drugs. Oral may, one of the good drug is cefixime. The dose is 10 mg per kg per day. Whereas IV ceftriaxone, the dose is 75 to 100 mg per kg per day. This is one thing very important we need to know. Okay, so oral cefixime I told you 10 mg per kg per day. IV I told you ceftriaxone 75 to 100 mg per kg per day. And duration, yes, this is also important. If it is a simple UTI, you will give for 7 days, and if it is a complicated UTI, you will give for 14 days. Okay, this is again very important. Simple question. Okay, so we have covered wonderfully. UTI topic only we finished. Urinary tract infection, the topic itself is finished within 5 minutes. Okay, are Are you understanding? So simple UTI you give for 7 days treatment oral, whereas complicated UTI you give for 14 days. Now what is complicated UTI? Any idea of how do you define complicated urinary tract infection? Number one, the patient will have fever more than 39 degrees Celsius. Okay, the patient will have kind of toxic features, toxic look, systemic toxicity or toxic look. The baby will have a very sick look. Okay, the baby will the baby will have a, you can say, persistent vomiting. The baby will have vomiting. The Because of vomiting the baby can have dehydration, vomiting, dehydration, and of course the kidney is a urinary tract infection, right? This is the kidney, right? And we have this ureter, and then we have this bladder. Okay, है ना? So this whole urinary tract, so the patient can have renal angle tenderness. Renal angle tenderness, yes or no? Am I making sense to you, everyone? It's We have to understand the concept and study. Okay, nothing to cram, there is nothing to cram here. Pain, obviously urinary tract. Okay, so patient will have renal angle tenderness, he can have vomiting. Because of vomiting he will have dehydration, of course he will have a toxic look, of course there is a fever, because system, it's a complicated UTI, no? That's why. Okay, very good. So I'll repeat again, the patient will have fever more than 39 degrees Celsius, systemic toxicity or toxic look the baby will have, vomiting, renal anger tenderness. Because of vomiting the baby can have dehydration, and also because of all this vomiting and dehydration my kidney starts getting damaged, so my creatinine level will increase. These are the points of complicated UTI for which you give IV cephalosporin, a third generation ceftriaxone drug of choice. Like ceftriaxone is a drug we give, and 100 mg, 75 to 100 mg per kg per day for around 14 days. Okay, and simple UTI, point number one, the patient will have a low grade fever. The patient will have a low grade fever. Now the different points of simple UTI and complicated UTI is, simple UTI will have a low grade fever, whereas complicated UTI will have a high grade fever. And simple UTI of course will not have all those symptoms. In simple UTI you will not have any kind of this symptoms. What are the symptoms you can have in simple UTI? Other than low grade fever, you have dysuria and frequency, and very important, urgency. Same, dysuria, frequency and urgency. Frequency, I'm going too many times urine. Urgency, if I have to go to washroom I have to go right now, I'm like I can't control it. Okay, and same, urinary issues. So dysuria, frequency and urgency the patient will have, and very important, without the symptoms of complicated UTI. These all without the simple symptoms of complicated UTI, that is known as simple urinary tract infection. Did you understand? Amazingly finished. Perfect. So always remember, you are the only architect of your life. You are the only architect of your life. So create something nice. Okay, you are the way you are studying. Like you are the only architect of your life. Like I am the only architect of my life. So I am planning beautifully. I go to gym. I'm very good in guitar classes. I love singing. At the same time, I'm very good with my job. You have to be good with your job. So I'm good with teaching also. I'm working also as a neonatologist. I'm very good with my patients. I'm very good in my clinic also. So see, so you have to create. You are the only architect of your life. You have to create what do you want to create, and so you better create something nice. It's like it's like a plain. It's like a plain white screen. Like I tell you to paint something. Like paint something on this picture, and remember, if once you paint, it will be there forever. मतलब कभी हट नहीं सकता, it will always be there. So you better paint something nice. So this is life. Once you sketch it beautifully, your beginning 20 to 30 years, जो आप शुरू के 20 साल आप कॉलेज में होते हैं, फिर आप आगे पढ़ते हैं, तो ये सब टाइम को बहुत ही सुंदर तरीके से, मतलब मैं तो कहता हूँ मोती की तरह ज़िंदगी बितानी चाहिए, मोती की तरह दिन होने चाहिए आपके, सुंदर सुंदर तरीके से आपको चीज़ों को बड़ा असेंबल स्केड्यूल। अभी भी मैं अपनी कॉपी दिखाऊं, अभी भी मैं लिटरली टाइम टेबल बनाता हूँ कि 1 घंटा मुझे क्लास लेनी है, 2 घंटा मुझे कुछ और करना है, 1 घंटा मुझे क्लिनिकल वीडियो बनाना है। तो आई डू टिल टुडे ऑल्सो, एंड दैट इज़ वाई आई एम सक्सेसफुल। सो द मोरल इज, you are the only architect of your life, so you better create something nice. Next question. All indicators are age dependent except. सो अगेन ये इंटरनेट क्वेश्चन किसका है? सीवियर एक्यूट माल न्यूट्रिशन का। जो हमारा टॉपिक है सीवियर एक्यूट माल न्यूट्रिशन, इन दैट ओनली वी हैव, आई टोल्ड यू राइट, वेट फॉर हाइट लेस देन -3 स्टैंडर्ड डेविएशन, मिड अपर आर्म circumference लेस देन 11.5 सेंटीमीटर, एंड edema, right? I told you just now. Please remember, mid upper arm circumference, mid upper arm circumference 6 महीने से लेके 5 साल तक ऑलमोस्ट एक ही रहता है, सेम रहता है। इसलिए वो हमारा एक इम्पॉर्टेंट क्राइटेरिया बन जाता है बच्चे का सैम डिटेक्ट करने के लिए। प्लीज रिमेंबर, मिड अपर आर्म सर्कमफ्रेंस स्टेज ऑलमोस्ट नॉर्मल, ऑलमोस्ट सेम रेंज from 6 months to 5 years. That is why mid upper arm circumference is one of the age independent criteria to diagnose SAM. Age independent criteria. Okay, where I don't, I'm where I where it's okay if you don't tell me the age of the child. बच्चा 2 साल का है, 3 साल का, 4, मान लो कोई मतलब any other baby has come from orphanage. I don't know he's 2 years, I don't know he's 4 years, or he's 8 months or 11 months. Just I will check his mid upper arm circumference. If that mid upper arm circumference is less than 11.5 centimeter, I will diagnose this baby's SAM from 6 months to 5 year, any baby. So I am not like, you are not dependent on the age to diagnose this SAM, okay? Like but through the mid upper arm circumference, because mid upper arm circumference remains the same from 6 months to 5 years. So I can say mid upper arm circumference is a age independent criteria. So the question is, all indicators are age dependent except the options are chest circumference, body mass index, weight for height, and MUAC, mid upper arm circumference. So yes, mid upper arm circumference is not age dependent, it is age independent. Because from 6 months to 5 years, this will remain the same. So baby is 2 years, 3 years, 4 years, doesn't matter. Only matters is mid upper arm circumference. So that is age independent criteria. So option number D is the best answer. Next, exclusive breastfeeding. Exclusive breastfeeding should be up to which age? Again, from it is the same question we have covered like some million times in our breastfeeding chapter. So exclusive breastfeeding, we do it for 6 months. Exclusive breastfeeding, we do it for 6 months. सिर्फ और सिर्फ माँ का दूध पिलाना है शुरू के 6 महीने। कोई शहद, हनी, पानी, शुगर, जैगरी, गुड़ कुछ भी नहीं देना, सिर्फ और सिर्फ माँ का दूध देना है। ओनली एंड ओनली मदर्स ब्रेस्ट फीड, इवन दो इट्स आउटसाइड 50 डिग्री सेल्सियस ऑल्सो, यू विल स्टिल गिव ओनली एंड ओनली ब्रेस्ट फीड। ओके, और आफ्टर 6 मंथ्स सर आफ्टर 6 मंथ्स व्हाट शुड आई डू? सो ब्रेस्ट फीडिंग फॉलोड बाय कॉम्प्लीमेंट्री फीडिंग। कॉम्प्लीमेंट्री फीड मतलब यू स्टार्ट कॉम्प्लीमेंट्री फीड्स। फॉर एग्जाम्पल 6 महीने के बाद यू गिव ब्रेस्ट फीडिंग, आफ्टर 6 मंथ्स यू विल गिव ब्रेस्ट फीडिंग, but with that you can give dalia, you can give smashed potato, right? You can give porridge, khichdi, any smashed item you can give after 6 months. But breastfeeding for sure you will do, okay? Don't stop breastfeeding. In our country, like after 6 months mother think कि 6 महीने हो गए हैं, अब मेरा फीड तो ज़रूरत है नहीं, डॉक्टर ने बोला है अब आप बच्चे को और खिलाइए और बाहर की चीज़ें मतलब घर का चीज खाना खिलाइए। बट डोंट स्टॉप ब्रेस्ट फीडिंग, यू डू ब्रेस्ट फीडिंग फॉलोड बाय विद you do this complementary feeding. Are you understanding? So breastfeeding should be done till 6 months of life. Choice of fluid in children with moderate dehydration is what? This also very beautifully I have covered previously in our classes also. I have covered the what you call the topic of diarrhea and dehydration. In the diarrhea, if the baby is having severe diarrhea, he will be dehydrated. So dehydration depend, it is mild dehydration, moderate dehydration or severe dehydration. Okay, एक बच्चा डायरिया का होता है, so many watery stools he is passing, he will be dehydrated. So it depends, it is mild dehydration, moderate dehydration or severe dehydration. Mild dehydration is treated at home. वो घर पे ठीक करते हैं हम कैसे? By giving ORS and zinc. By giving ORS and zinc. Moderate dehydration, you give either ORS or ringer lactate, and severe dehydration you give only ringer lactate. Okay, For moderate dehydration, you give ORS or ringer lactate at the rate of 75 ml per kg, at the rate of 75 ml per kg for 5 to 6 hours. This is the correction you give. Moderate dehydration, you give ORS or ringer lactate. If the option between ORS and ringer lactate, ORS is our best option. In severe dehydration, where the baby will have sunken eyeballs, where the baby will have, kind of decreased urine output, or the baby, most importantly, the skin turgor of the baby goes very slowly. Refusal to feed, very important. I've told you 1,000 times. In moderate dehydration, the child will be eagerly drinking the bottle, eagerly drinking the water, whereas in severe dehydration, there will be refusal to feed. That's another difference. So the question is, choice of fluid in moderate dehydration is nothing but ringer lactate, because normal saline you give in shock, in hypovolemic shock. Normal saline will be the fluid of choice in a case of hypovolemic shock, and 10% dextrose will be the what you called is the fluid of choice for hypoglycemia. For hypoglycemia, even neonatal or hypoglycemia in any condition, 10% dextrose is our best answer. For hypovolemic shock, normal saline is our best answer. For dehydration, for diarrhea, moderate dehydration or diarrhea, in that case, ringer lactate is our best solution. And for severe dehydration, you give ringer lactate at the rate of 100 ml per kg. 100 ml per kg. Are you understanding? And mild dehydration you treat at home by giving ORS and zinc. And how much zinc do you give? That's another exam question. For baby less than 6 months, we give 10 milligram of zinc per day, and baby more than 6 months, we give 20 milligram of zinc per day. That's another exam question. Okay, less than 6 months baby, you give zinc 10 milligram per day. For more than 6 months, you give 20 milligram per day. And again, zinc is given for how many days? That's another question. Zinc is given for 14 days. 14 days. Normally any other medicine given for 5 to 7 days, but zinc is something which you give for 14 days. 14 days. Okay, understood? Done? Very good. So that's it. And ORS also. Let me ask you extra question. So how much is potassium in ORS? These are the extra question. How much is potassium in ORS? The answer is 20 milliosmoles per liter. How much is sodium in ORS? 75 milliosmoles per liter. Anything which is also 75 in our ORS, glucose. Glucose is also 75 milliosmoles. The unit is milliosmoles per liter. How much is citrate in ORS? Citrate is 10, and chloride 65. Chloride 65. Okay, total is 245 milliosmoles per liter. 245, the total osmolarity of the ORS is 245 milliosmoles per liter. What is ORS? Oral rehydration solution. Oral rehydration solution. How do you make it? You take 1 liter of water bottle and 1 packet of ORS. In 1 liter of water, you add 1 packet of ORS and tell the child to drink. Okay, so I'll repeat again. Potassium has been an exam question. Please remember, how much is potassium in ORS? They have asked. So potassium is 20, sodium 75, glucose 75, citrate 10, chloride 65, and total osmolarity is 245 milliosmoles per liter. Okay, again, a very beautiful quote. The quote says, there is no elevator to success. There is no elevator to success. We all have taken the stairs. Please remember, there is no shortcut to success. There is no shortcut. Students, they ask me, sir, आपका 2 दिन का क्लास कर लेंगे तो पास हो जाएंगे क्या? Sir, if I do only your notes, will I pass or not? Yes, dear. If you do my notes, if you do my videos, in the videos, of course, I have covered A to Z everything. बट सर, इफ़ आई डू ओनली योर रैपिड रिविजन विल आई पास? सर, आपका चैंटिंग सेशन बहुत अच्छा था, चैंटिंग करूंगा तो पास हो जाऊंगा क्या? ऐसे नहीं होगा. ओनली इफ़ यू डू चैंटिंग सेशन, ओनली इफ़ यू डू रैपिड रिविजन, you will not pass. You have to study as a whole, right? You have to get your concepts done. You have to read the theory. You have to be very good in theory, followed by MCQ. Read a topic nicely, do the MCQs. Read a topic, do the MCQs. So you have to work hard. In short, you have to work really hard. Smart work, definitely smart work you can do, not hard work. I would say smart work. Like, do one chapter, then do the MCQ. Read breastfeeding, do the MCQ. Read vaccine chapter which I've taught you, do the MCQ, like that. So smartly you finish. Do the mnemonics. For example, 3, 4, and 5 mnemonics. Like a 3-year-old can ride a tricycle. 4-year-old can do a hopping मतलब लंगड़ी टांग से खेलना, and 5-year-old can do skipping. So 3, 4, 5. So now right now in 3 seconds I covered 3 milestones. A 3-year-old can ride a tricycle, a 4-year-old can do hopping, and a 5-year-old can do skipping. Finish. So smart work, smart work, smart work. So the morale is there is no elevator to success. We all have taken the stairs. Students who have got rank 1, you ask them, they have really worked hard. They have really worked hard. Even me as a teacher also, you have no idea how much I have worked hard. These slides to make you feel good, to make you understand the concept so nicely. Heavy things I'm teaching so simple, so sweetly like that. So it takes a lot of effort. So the morale is there is no elevator to success. We all have taken the stairs. So you also work hard. Okay. Next question. The length of a child doubles by how many years? Again, same. This also we have covered in growth and development. So many times I've taught you this topic. So please remember, as far as length, see, a normal length, the normal length of a baby, of a newborn, is 48 to 50 centimeter. The normal length of a newborn is 48 to 50 centimeter. This 50 centimeter becomes 100 centimeter by 4 years of life. By 4 years of life. A normal baby is normally 50 centimeter of length. By 4 year, he becomes 100 centimeter by length or by height, and by 12 years he becomes 150 centimeter. 150 centimeter. So what did we learn? We learned that length doubles by 4 years, and it triples by 12 years. Length doubles by 4 years and triples by 12 years. A baby who was 50 centimeter is now 100 centimeter at 4 years and 150 centimeter by 12 years. So 50, 100, 150. 50, 100, 150. 50 by birth, 100 by 4 years, 150 by 12 years. So the best answer, the length of a child doubles by 4 years. Doubles by 4 years. Very simple question, and this like million times I have told in growth and development chapter, which we have done in the videos. If you are a newcomer, please remember, dear, please study all the videos, do it nicely, thoroughly, read all the chanting sessions and rapid revision which I have done. I mean, I have covered everything. It's like everything I have covered. If you do it, it's nice. And it's like it's not just pediatrics we are studying right now. It's like pediatrics integrated with medicine, pediatrics integrated with gynecology. Like breastfeeding is there in gynae also, it is there in pediatrics also. Vaccine topic is there in community medicine also, it is there in pediatrics also. Asthma, pneumonia, nephrotic syndrome, tetralogy of Fallot is there in medicine also, it is there in pediatrics also. So it's like all three, it's like an integrated approach. So if you're studying pediatrics, don't think you are just studying a small minor subject pediatrics. मेरे को तो बहुत सारा पढ़ना है, ये छोटे वाला सब्जेक्ट कौन ही पढ़ेगा? No, don't have that attitude. If you do pediatrics, you're covering 3-4 subjects all together. So choose wisely. Which size of suction catheter is used in a child, or you can say in a child, or basically in a neonate? So I told you we have done this question also in the NRP guidelines. What is NRP guidelines? Neonatal resuscitation protocol. Resuscitation protocol. Wait, spelling. Resuscitation. Wait. Yes, in neonatal resuscitation protocol, we have done this. Okay, what you called the normal, what you call the suction catheter which we use is 6 to 8 French. 6 to 8 French suction catheter we use. So that is why 8 is our best answer. The suction catheter size which we use is 8 French for suctioning a child or suctioning a newborn, basically, if I talk about in NRP guidelines. Okay, and also the suction pressure, let me tell you an extra point. The suction pressure which I require will be 80 millimeter of mercury, 80 millimeter of mercury, or 100 centimeter of water. 80 millimeter of mercury or 100 centimeter of water. The suction pressure which I use for a baby, for suctioning a baby, a newborn or small baby. Okay, the suction pressure is 80 millimeter of mercury and suction or 100 centimeter of water. The suction catheter, the size which we use is 6 to 8 French. French. The unit is French. Okay. Complementary feeding. Again, this question came in shift one, the part one, and again we have covered this beautifully. Complementary feeding you starts by 6 months. See, exclusive breastfeeding you give for 6 months, and after 6 months, I told you start the complementary feeding. Complementary feeding, like I told you, we can start dalia, we can start khichdi, we can start like boiled potato and you smash kar do usko, so that we can start porridge, we can start porridge also, we can start. So all these smash items we can start as a complementary feeding. Okay, and what's the definition of exclusive breastfeeding? What is the definition of exclusive breastfeeding? So you know that, I'll just tell you. So no food or drink, एक्सक्लूसिव मतलब हिंदी में क्या बोलते हैं, सिर्फ और सिर्फ माँ का दूध पिलाना है और कुछ नहीं पिलाना. सो नो फूड और ड्रिंक unless medically indicated medicine. No food or drink unless medically indicated medicine. Breastfeeding started within 1 hour of life till 6 months. That is known as exclusive breastfeeding. I'll repeat again. No food or drink unless medically indicated medicine. Breastfeeding started within 1 hour of life till 6 months is known as exclusive breastfeeding. Okay. Okay, question number 11. A child reported an emergency with acute bronchospasm. Spasm हो गया बच्चे को. And a history of bee sting. Which is the most preferred used drug of adrenaline? So you know that if someone has, the baby has got a bee sting and he has got a bronchospasm. So this is like a anaphylactic reaction. It is like a anaphylaxis. इसको allergy anaphylactic reaction the baby has got. In that case we always give adrenaline. Okay, so adrenaline can be, in general, it the options of giving adrenaline, yes, it can be given intratracheal, it can be given subcutaneous. Okay, very important. And remember, like IM, you don't give adrenaline IM, you don't give adrenaline interosseous. As far as subcutaneous and intratracheal is concerned, so for a rapid mechanism of action, it is given subcutaneous. Subcutaneous is very good, no? Which jaldi se suddenly you give and that's it. It's a rapid action. Intratracheal, you have to intubate the baby. Baby is also already having bronchospasm. His larynx is already spasm. So after, you have to intubate the baby, secure the air with the laryngoscope, with the what you call endotracheal tube, and then give adrenaline. It's quite a long process. Subcutaneous is so easy, Bacha aate hi, once he come and sit with you, suddenly you can give a subcutaneous adrenaline. It's a very good mechanism of action, like the rapid action. Okay, so subcutaneous is the best answer. What is the chest compression? What is the chest compression to ventilation ratio in neonatal resuscitation? This also very beautifully we have covered in our chapter of neonatology. In the chapter of neonatal resuscitation, very nice question actually has come. I'm like, we are very lucky. I mean, students who have given this exam, you must be very lucky. Malab, these are very smart questions and very fast. We have covered this so many times. The ratio of chest compression to ventilation ratio is 3:1. Means 3 times I'll do chest compression and 1 time I do BMV. What is BMV? Bag and mask ventilation. You have seen the device, right? Bag and mask ventilation, yes or no? Bag and mask ventilation. What is CC? CC is chest compression. So you see, look at the camera. See, so 1, 2, 3, 1. 1, 2, 3, 1 means 3 times. I need two people. Okay, one person will do chest compressions, 1, 2, 3, and I will do bag and mask, one like that. So 1, 2, 3, 1, 1, 2, 3, 1. Remember, that is known as 3:1 compression and ventilation ratio in neonatal resuscitation. Okay, that is what you should know. And when the heart rate is less than 60, when the heart rate is less than 60, then you will do chest compression and back and mask. And chest compression also, there are two techniques of chest compressions. Either there is a finger technique or there is thumb technique. Two finger technique and thumb technique, which I'm doing right now is two finger, 1, 2, 3, like on the Zephod process I'm putting my fingers 1, 2, 3, and other person is doing 1, like the ambu bag is putting in my mouth and doing 1. So 1, 2, 3, 1. But remember, instead of this two finger, thumb technique is better. Like I can take the whole circumference of the chest and 1, 2, 3. So that thumb, I'm using my thumb, 1, 2, 3, okay, and then 1. So 1, 2, 3, like I'm putting in the whole chest circumference and Zefort process I'm touching. So 1, 2, 3, and other person will do 1. So thumb technique is better than the finger technique. So extra questions I'm telling you, okay. So 3:1, 3:1 is our best answer. Baby admitted in hospital with complaints of foreign body aspiration. The nurse will do what? 5 back slap, 5 chest thrust, 2 black back slap, 2 chest thrust, cardiopulmonary resuscitation, or Heimlich's maneuver. So yes, the best answer for this for anyone, not even in hospital, in restaurants while having food, is sometimes it happens instead of what you call going food into the esophagus, it goes into the trachea. That is why the meaning of foreign body aspiration. Aspiration only happens when I'm supposed to take something in my esophagus, it will go in the trachea or in the lungs. Okay, so foreign body aspiration, the best management which we do is Heimlich maneuver. You might have seen this picture, no? I'll show you a picture. This one. Can you see that? So it's a typical picture of Heimlich's maneuver where we put a thrust we put the whole hand on the baby's, on the person's abdomen and the little upper part, and we do this Heimlich's maneuver. So just in general, you should know Heimlich's maneuver is the best thing for a foreign body aspiration. Identify the correct method. Identify the correct method of inserting catheter in a neonate. Yeah, this is a very good question. Catheter. Which catheter? Actually, they're asking about urinary catheter, okay, in a neonate. Identify the correct method of inserting a urinary catheter in a neonate. Okay, so the options are 12 French is appropriate size for catheterization in neonate. No, that's not right. There is no specific, it all depends. It's a preterm child or a term child. Sometimes 8 French, 10 French also we use for catheterization. No requirement of jelly. No, that is also wrong. We always require little jelly. Whenever we put a catheter, we always take some jelly. If this is a catheter, I will roll the jelly through on the catheter. Like I will roll the jelly or the catheter and jelly I'll roll, and then I will insert through the penis of the newborn. So no requirement of jelly is wrong. Inflate the balloon after insertion of entire catheter means, are you understanding? You insert the, if this is a penis, you insert the full catheter and then you inflate the balloon, like inflate, there is a balloon, right? Like if right, if this is a normal catheter and okay, this is the penis, okay, this is the penis. Once I put this catheter inside, manlo example, I have inserted the full catheter, okay. Now remember, in this catheter here there is a balloon. Here I will take a 5 ml syringe, 5 ml syringe. So 5 ml air I will push. I will push 5 ml air here. So what will happen? This balloon will inflate. This balloon will inflate. Why, sir? Why did you do that? Why did you inflate the balloon inside? Because if you try to remove this now the catheter, it won't remove. It will get stuck. It will get hold over in the urinary bladder. Nice, no? Because otherwise it will come out only. So the option is inflate the balloon after insertion of entire catheter. This is the best answer. That's what we do. The other option is inflate the balloon when urine seen no matter location of catheter. No, this is wrong. They are saying that once you start putting the catheter, manlo this much only I put the catheter, okay, in the urine, in the penis, and now urine start coming out. So no, and that does not mean that right now only I'll inflate it 5 ml and I'll put the balloon here. Like if we inflate at this point, then the whole penis will get damaged and there'll be blood coming in there'll be hematuria. Okay, are you understanding? Like the basic knowledge is you inflate the balloon after insertion of entire, this entire word is important, entire catheter, not half catheter. If you put half catheter, little bit catheter also, urine starts coming out. So urine will anyhow come out, but you have to put full entire catheter inside, then inflate the balloon. If you put just half or just think a urine is coming, I let me inflate, no, the patient will get a huge painful hematuria, painful. This I remember one of my junior resident, he did that of a adult patient. Actually, he by mistake not put the catheter inside fully, half he did, and he put full, like then balloon he inflated. My goodness, there was blood, there was very bad blood, blood in the urine like crazy, and the very painful, it was very painful. We had to call the surgeon actually for doing the further management, so it was very bad. Okay. Okay, weight of an infant quadruples by how many years? Quadruples. Again, this we have beautifully covered in our growth and development. Congrats again to the students who have cleared. I mean, if you have done my sessions, no videos, if you have seen, I mean, full rank, full rank. So please remember, you know that weight. What's the normal weight of a newborn? The normal weight of a baby is 2.5 to 4 kg. That's the normal weight of a baby. Weight doubles by 5 months. Weight doubles by 5 months. Triples by 1 year. Triples by 1 year. And quadruple by 2 years. Quadruple by 2 years. Means if a baby is 2.5 kg born, at 5 months he will be 5 kg. Weight doubles by what you called 5 months, and it triples by 1 year. Quadruple becomes 4 times by 2 years. So 2 years is the best answer. Weight quadruples by 2 years. Okay. Failure is not life. Sometimes we say, for the students who are appearing for the second time or third time, फेलियर इज नॉट लाइफ. फेल होना जिंदगी नहीं है कि ओ माई गॉड आई एम फेल नाउ, ओ गॉड व्हाट विल हैपन, ओ माई गॉड इट्स सो टफ, ओ माई गॉड दिस, ओ माई गॉड दैट. तो फेलियर इज नॉट लाइफ. इट इज अ पार्ट ऑफ लाइफ. इट इज अ पार्ट, इट इज अ फेज. So it will go one day. So you have to counsel yourself, you have to forgive yourself, you have to take care of yourself. Failure is not life, it is a part of life, and it will go one day. It will surely go one day. ये एक फेज होता है बस, it's just a phase. तो अगर तब तुम समझ गए जिंदगी के बारे में, तब तो तुम्हें कोई भी नहीं हटा सकता, कोई भी नहीं हरा सकता, तुम हमेशा जीतोगे. So failure is not life, it is a part of life. And if it is only that part, you have to hold yourself. You have to hold your heart rate, you have to hold your energy that it's okay, it's just a phase, it will go. It's just a phase, it will go. Okay, I will not break down. I will not be broken into thousand pieces. I will be strong. I am very strong. I am very strong. Like that. Okay. So failure is not life, it is a part of life, and it will go one day. Okay. Signs of dehydration in children. What are the various signs of dehydration? I told you there are three types of dehydration: mild dehydration, moderate dehydration, and severe dehydration. Again, in severe dehydration, there will be sunken eyeballs. I told you just now, there will be sunken eyeballs. The child will be very irritable, of course. Yes, he can cry also. But most importantly, moderate dehydration baby will be eagerly drinking the water bottle. Okay, whereas severe dehydration will have refusal to feed. Refusal. He'll be in a shock. He'll be in a shock state. He'll be very decreased blood pressure, decrease urine output, most importantly. So he'll be in severe dehydration. So sunken eyeballs, irritability, crying, so all of the above are this is the signs of dehydration. But moderate dehydration will be eagerly drinking the bottle of water, whereas severe dehydration will not be drinking the bottle of water. Very important. Okay. And skin turgor also. Skin turgor goes slowly. Skin turgor is goes slowly, right? And you pinch the skin, the rectus abdominis, that's the muscle, parallelly, longitudinally. You pinch and count 1001, 1002, 1003. Then you take off the pinch, and you will see that that skin pinch which you have done, it will go to a normal state very slowly, very slowly. It's a sign of severe dehydration. A child was suffering from common cold. A child was suffering from common cold. After 2 weeks, he started having pain in the ear. What could be the probable diagnosis? So, a basic common cold baby, they always have this kind of middle ear infections. Common, once I get a common cold, my eustachian tube can get blocked. Okay, eustachian tube can get blocked. So, if I'm having pain in my ear, of course, I can have any middle ear infection or otitis media. Otitis externa, external ear infection. Otitis media, middle ear infection, like that. Okay, not tonsillitis, not sinusitis. Otitis media is the best answer. Okay. Low birth weight baby. Low birth weight, again we have covered this so beautifully, so nicely in the videos we have covered in neonatology. Yes or no? बहुत अच्छे से पढ़ाया मैंने ये वाला टॉपिक, ये सारा बिल्कुल एकदम मोती की तरह आए हुए हैं क्वेश्चंस, मोती की तरह, ये कोई भी बता दे आंसर्स। अगर 7th क्लास के बच्चों को भी अगर मैं अपना वीडियोस दिखा दूँ तो ये 7th क्लास का बच्चा भी ये क्वेश्चन सॉल्व कर सकता है। सो नॉर्मल वेट ऑफ अ बेबी इज 2.5 to 4 kg। अ बेबी हु इज लेस देन 2.5 kg, 2.5 किलो से कम के बच्चे को हम क्या बोलते हैं? LBW। व्हाट इज LBW? लो birth weight. Okay, and there is something known as very low birth weight and something known as extremely low birth weight. So baby who is less than 1.5 kg will be very low birth weight, and baby who is less than 1 kg will be extremely low birth weight. So low birth weight baby is less than 2.5 kg. Low birth weight baby is less than 2.5 kg. Normal pulse rate in a newborn, normal pulse rate or I can say heart rate in a newborn. So देखो ये अच्छा क्वेश्चन है. So 120 to 160, 120 to 160 beats is the normal heart rate of a newborn. And see, for examiner to confuse you, the examiner has told 140 to 160 also, and I'm very sure some babies have written 140. Some babies, I'm saying, some students might have ticked 140 to 160, but the best answer is 120 to 160 beats per minute, the normal heart rate of a newborn. So the normal heart rate or a pulse rate of a newborn is 120 to 160. The normal respiratory rate of a newborn is 40 to 60 per minute, 40 to 60 cycles per minute. Okay, are you understanding? These two things you should know. Septic shock. Septic shock in a child is a type of which shock? Septic shock is in a child is type of which shock? The options are distributive shock, hypovolemic shock, cardiogenic shock, and most importantly obstructive shock. So this also we have already done in our segments. I have already taught you this part. Like the most commonest type of shock, if I talk about the most commonest type of shock, is nothing but hypovolemic shock. The most commonest type of shock is hypovolemic shock, because of the diarrhea or because of the dehydration, any losses. Hypovolemic shock is the most commonest type of shock. That is the first point. Then in the classes I'll show you one question. See, the most commonest cause of shock in children is hypovolemic shock. That is the first MCQ which came in previous year question papers. Okay, most common cause of shock in children is hypovolemic shock. Remember, see, dash is the most commonest cause of shock in children. The answer is the first commonest cause of shock in children is hypovolemic. The second most commonest cause is nothing but septic shock, or is also known as distributive shock. Okay, septic shock, distributive shock, these all comes in one category, kind of one types of septic shock. So septic shock or distributive shock, this is the second most commonest type of shock. And that's what the MCQ they have right now asked, that septic shock, it is a type of which shock? So septic shock or distributive shock, both are almost same only. That's the question. Septic shock, is it a type? It is a type of distributive shock, because hypovolemic shock is different, cardiogenic is different, and obstructive is different. So septic shock in a child is a type of distributive shock. And third most commonest type is nothing but cardiogenic shock. See, that's how the question comes. I always tell, if this time, like last few year question back, they told most commonest cause of shock in a child is what? The answer is hypovolemic shock. Now this year same topic, but the question is different. Can you see that? Means shock topic is important, right? Shock is important. So this year they have asked about this, that septic shock is a type of which shock, and I've told you it's a type of distributive, septic or distributive shock. So this also over. Okay. Yeah, a 3-year-old child presented with acute respiratory infection. A 3-year-old child present with acute respiratory infection, right? Yes or no? Okay, so the question over here is that nurse should avoid what? What a nurse should avoid? The options are: number one, oxygen. Will you avoid oxygen? No, right? You will give oxygen. The baby is having acute respiratory infection, so you will give oxygen, right? Provide position to side lying. Yeah, sometimes in a baby, to make the baby little relief, sometimes we keep the baby in propped up position. Propped up matlab आधा उठा हुआ, मतलब 45 degree bed we no, 45 degree we elevate the bed. Okay, so propped up or even providing position side lying also we can give that. Oxygen we can give, but mouth and nose suctioning you should avoid. The baby is having acute respiratory infection, and that one suctioning the mouth and nose, like, it's of no use also. And we don't do in acute respiratory infection, there is no link of suctioning the mouth and nose. There is a link of giving oxygen, there is a link of provide position to side lying or propped up like that, but there is no link of suctioning the mouth in a case of acute respiratory infection. And even if it can flare up the infection also, in some books they have written, right? Because acute respiratory infection means droplet spread is there. Droplet, it can cover, can spread anywhere. So A is the best answer. The nurse should avoid mouth and nose suctioning. Dose of injection adrenaline during infant cardiac arrest. This also so nicely we have done, like cardiac arrest, it's so nice. Adrenaline dose, remember, yes or no? So we have done, it's very nice question. So adrenaline is given at the rate of 0.1 to 0.3 ml per kg. 0.1 to 0.3 ml per kg in 1 is to 10,000 dilution. Okay, in 1 is to 10,000 dilution. Like in this question, I'll cut the extra zero. Okay, I'll cut the, yeah, extra zero. Okay, yeah. So what do you think is the answer? A, B, C. This is what recall questions we are able to get. So adrenaline in a cardiac arrest or in resuscitation protocols is given 0.1 to 0.3 ml per kg in 1 is to 10,000 dilution. I have always told you this ADR, adrenaline ampule, comes under 1 is to 1000 dilution, but I have to make it into 1 is to 10,000 dilution by taking 1 ml of adrenaline plus 9 ml of normal saline. So इससे क्या होगा, ये 10 times dilute हो जाता है, it becomes 10 times diluted. So 1 is to 10,000 dilution, and that of that thing I give 0.1 or 0.2 or 0.3 ml per kg. So 0.1 ml per kg in 1 is to 10,000 dilution. This is our best answer. 0.5 ml per kg IM, no, IVM we don't give, we give only IV. 1 ml per kg से, हाँ, this is 1 ml, this is 0.1 ml, so 0.1 ml. A is the best answer. Okay. Okay, identify the image. Identify the image. In this case, the options are chickenpox, mumps, and measles and rubella. It's very easy. I'll tell you. If this was a chickenpox picture, the in chickenpox कैसे होते हैं दाने? The baby will have a maculo papular vesicular rash. Vesicular rash. What do you mean by vesicular rash? Vesicle means like a watery discharge. They will typically show you the cases of vesicles मतलब watery discharge, मतलब dew drop appearance. Anyone who has read chickenpox will remember that I have taught this in my classes, that chickenpox will have a dew drops, मतलब बारिश, जब पहली बारिश होती है तो उसमें जो पत्तों में जो पानी की बूंदें गिरती हैं, अगर हमारा ये अगर ये पत्ता है, दिस वन, तो इसमें जो पहली बारिश की बूंदों की जो पहली बूंद, फर्स्ट ड्रॉप ऑफ द रेन विच हैपन्स ऑन द लीफ, that thing is known as dew drop appearance of the rash. So the patient will have maculopapular vesicular rash. Okay, so इसमें कहीं भी वो पिक्चर नहीं है. In this one there is no vesicle, they have not shown vesicle in this picture, so chickenpox is totally out. What about mumps? Why it can't be mumps? Mumps patient comes with parotitis. If this question they want to ask you a MCQ of mumps, they should be showing a picture of baby having swelling of the gland, swelling of the parotid gland, unilateral or bilateral, or even the baby can show orchitis. They would have showed a swelling of testes, or they would have shown a swelling of parotid gland. That's what happened in mumps, not this. This is the typical case of measles. In the measles, what happens? The rash, this is a typical case of measles. Okay, in the measles, the rash starts behind the ear, then the face, then the trunk, and then the abdomen, and then the lower limb. Okay, starts behind the ear and face and trunk and abdomen and lower limb. The rash. Which rash is there? Is there maculopapular rash? Macule means change in color. There'll be change in the color. Can you see red rash? No, these all are red rashes. And papule means change in color, but there is a elevation. There is a little elevated lesions will be there. That is known as papule. So they will have lesion which are little elevated and change in color. So maculopapular rash you will see in measles. Behind the ear it will start, then face and trunk and lower limb like that. Okay, and most importantly it is centripetal. Centripetal means petal मतलब पी से पीटल, पी से पेट, बाहर पेरिफ्री में कम होंगे, सेंटर में ज़्यादा होंगे, उसको बोलते हैं सेंट्रीपीटल रैश. Rashes which are there everywhere but less on the peripheries and more on the trunk. More on the trunk. Can you see over here? It's like highly densely populated here, the rash. Centripetal, पेट की तरफ जाता हुआ, maximum in the center. This is a centripetal rash. It's a typical case of measles. And what else? One more thing I want to tell you. Yeah, and remember the most common complication of measles is otitis media. The most common complication of measles is otitis media, कान का infection, and most common cause of death in measles is pneumonia. These all are MCQs. The most common complication of measles is otitis media, and most common cause of death in measles is pneumonia. Okay, that also you should know. Okay, according to WHO, severe acute malnutrition assessment in a child depends on what? This question came in shift 2. There were two shifts in the exam, shift 2. Same, Sam, again, same thing they're asking. I told you this also multiple times. I've told severe acute malnutrition is defined as weight for height. Weight for height less than -3 standard deviation. This is that's how WHO defines SAM, right? Weight for height less than -3 standard deviation, mid upper arm circumference less than 11.5 centimeter, and edema. Remember, just now three questions on SAM has come. Okay, one question was on of mid upper arm circumference. One question is this one. How do you define SAM? Weight for height less than -3. It is not weight for age. It is not diet. It is not BMI. It is weight for height. Okay, done. Yes, that beautifully finishes all the recent recall questions for the Norcet 2021 exam. Congratulations for those who have done well, and best of luck for those who are going to appear now. Okay, this was a very important session which I have just now covered. Very important. It's like a amazingly high yield questions. एंड अगेन जाने से पहले हमारा एक बहुत प्यारा कोट जो कहता है कि डोंट बी बिटर बाय पास्ट, डोंट बी बिटर बाय पास्ट, बी बेटर बाय पास्ट. डोंट बी बिटर बाय पास्ट, बी बेटर बाय पास्ट. जिंदगी की फेलियर्स, जिंदगी की प्रॉब्लम से कड़वे मत बन जाओ, वक्त के साथ बेहतर बनो. Don't get bitter by the past. Once we see so many failures in life, we get so agitated, so irritated. Once we do have lot of breakups, relationship breakups, we get so irritated with life. Once we see so much of failure, so much of fight at home, or any issues or failures or exam failures, we get so bitter, we get so irritated, you know, like people will say कि तेरे को क्या हुआ है, तू इतना चिड़चिड़ा क्यों हो गया, why you become so edgy, so you know, stubborn like that. So don't be bitter by the past. Be better by the past. Learn from your mistakes. Face your mistakes. You know, take courage to accept your mistakes and move on and be better. Be better. You know, you should say अच्छा हुआ मेरे साथ ये हुआ, चलो अब मैं बेटर बन गया. अच्छा हुआ मैं फेल हुआ, मैं बहुत रट रहा था. अगर रट के पास हो जाता तो शायद पेशेंट को रियलिटी में सर्व नहीं कर पाता. If I would have crammed and learned, and if I would have crammed and clear the exam, I would not be able to serve the patient in a proper way, you know, because cramming will not help in treating the patient. It will only help in clearing an exam. But if you understand the concept, if you cram, if you don't cram and understand the concept, then of course you will clear the exam, and at the same time you will have a better approach once you see your patients, your, you know, all your patients. So that's what, you know, don't be better by the past, Don't be bitter by the past, be better by the past. Thank you so much. Thank you so much for watching this wonderful session. And my mobile number is 9999897081. You guys are most cordially invited. I have this free WhatsApp, Telegram, and YouTube groups. You can put your name and that you have attended my class, and I will put you in a free state-wise WhatsApp group for the daily one-liners, updates, recent updates, images of pediatrics, and day-to-day basic learning of pediatrics. It'll be beneficial for you, no doubt. And thank you so much. Thank you so much for the participation, and best of luck to everyone. And that's it. And everyone is praising about our app. Everyone is praising about the way we are teaching, because we are genuinely teaching nicely. So अच्छे लोगों के साथ अच्छा ही होता है. If you are actually teaching well, you have to be good at your job. You don't run behind money. Don't run behind getting rich. Just be good at your job. If you are good at your job, people will come to you. So you have to study, clear an exam, and get a good job. And if you're good at your job, people gonna come to you. It's as simple as that. So don't run behind money. Don't run behind getting rich. Just be good at your job. If you're good at studies, if you're good at your job, people are gonna come to you. Okay. So thank you so much. All this love, all so many comments we have got from everyone. And like अगर मैं पढ़ने बैठ गया तो 1 घंटा लग जाएगा. बहुत ही सारे beautiful comments हैं, compliments हैं. And thank you so much for watching this webinar, and take care. Bye.